So yes, I'm going to be talking about what universal pharmacare is, why we need it, and how it'll work in practice and why it makes sense. So a brief history of our current healthcare system that we have in Canada. So predating everything essentially was Medicare in Saskatchewan, implemented under Premier Tommy Douglas. He so first, both in Canada and in Saskatchewan, came the universal provision of hospital care. So everyone was able to go to the hospital for free and be looked after and not have to worry about getting paid. So once Saskatchewan did that, another Saskatchewan politician came into power as prime minister, John Diefenbaker, the second picture from the left, and he said, "Let's do the same thing in all across the country." So what the federal government did is they subsidized half of all hospital costs in Canada for every province, and the provinces were left to cover the other half, and this gave birth to free hospital care. And then subsequently, the Saskatchewan Commonwealth Confederation or Cooperative Commonwealth Federation implemented their universal Medicare. So for the majority of medical costs are, your doctor's visits and things like that. So they implemented a universal program for doctor's visits and other medical care costs. And then when Premier Tommy Douglas left office, became leader of what is now the New Democratic Party, and they were able to pressure, probably would be the right word, current Prime Minister Lester B. Pearson, who was in a minority government at the time, like we are now, into adopting a complete, total universal healthcare program across the country, as we sort of know now. And then finally, the most sort of recent big development in our universal healthcare system was the 1984 Canada Health Act under Prime Minister Pierre Trudeau, which sort of laid the groundwork for what our universal healthcare system is today. That's the healthcare you see in Canada today, is the Canada Health Act. No co-pays, no nothing. You just go to the doctor. That's it. So what do we mean? What do I necessarily mean when I talk about pharmacare, aside from healthcare? So this presentation pertains almost entirely to the report done by the Advisory Council on the Implementation of National Pharmacare. It was commissioned by Parliament. Their proposal on how pharmacare will work is that Canadians should never pay more than $5 out of pocket for a prescription, and $2 for all essential medicines. And once you hit $100 for the year, so you've paid $5 or $2 a whole bunch of times, you reach $100, that's it. You don't have to pay anymore. And anyone receiving any form of social assistance, or if your income is extremely low, then you would be exempt from all costs. So that's what we're talking about when we talk pharmacare right now. So why do we actually need pharmacare? What sort of things make this necessary? So I'm just going to go over some quick facts. So in 2016, 3 million Canadians reported that they don't take the medicine that they need because it's too expensive. And there are other surveys that put that number even higher. Of those approximately 3 million people, over 1 million of them are already on private insurance plans. So they already pay money to receive prescription drugs. And even then, they're still not able to afford the drugs that they need. 1 million Canadians purposely, I believe this is 2016, purposely cut down their heating and food costs so they could afford medicine. And Canada is actually the only country in the world that has a national universal healthcare program that does not include prescription drug coverage. And it's one of two countries in high-earning countries in the world that does not have a prescription drug coverage plan nationally, the other being the United States. Not to mention, every single major study done on Canada's universal healthcare system has recommended a national pharmacare system, and that's just a list of some of the bigger studies done there, most of which were commissioned by the government. 88% of Canadians actually support universal healthcare, and over half of Canadians, so I think it's 51 or 52%, strongly support a national health or pharmacare program. So how do we pull this off? We know, so we've established that it's something that we should probably have. We're the only country with universal healthcare that doesn't have anything for prescription drugs. So how do we do it? So let's talk about cost or not, because it's actually cheaper than what we have now. So the kicker here being negotiation. So right now, what we have is we have a sort of smorgasbord of companies, private companies, whether your Shoppers Drug Mart, your Jean Coutu, whatever, that negotiate drug prices, and they go to these pharmaceutical companies that produce the drugs, and they say, how much can we get these drugs for, and they're trying to make a profit, so they're not really pushing too hard. But when we consolidate all of our drug purchasing, instead of it being again under loads of different companies that are each individually negotiating their drug prices from the pharmaceutical companies, when it's one sort of national effort by the federal government to negotiate drug prices and what we're going to get our drugs for, it's a lot different. Because we essentially have the monopoly on negotiation. We're negotiating as one country how much we're going to pay for our drugs. Not to mention, we can do things like, and this is all outlined in the National Council on National Pharmacare, outlining, we can do things like generic drugs instead of buying specifically from the big pharmaceutical companies. It's the same chemical compounds, all these things, but we can buy them from smaller companies at a lower price. There's things called biosimilars, so medications that are very, very similar to some of the more expensive ones that produce the same effects, just certain little chemical things are different with no side effects, that sort of thing. So how much will we actually save? That's the big thing. So Canada, our government, it's $5 billion cheaper to actually implement a national pharmacare program. Individually speaking, so aside from the government, how much is everyone else going to save? So national pharmacare will reduce annual system-wide spending on prescription drugs by $5 billion. That's what we're talking about. Collectively, between businesses and employees, they're going to see their prescription drugs costs, and this is by the year 2027, reduced by $16.6 billion annually. Families are going to see their out-of-pocket drug costs, this is collectively across the country, reduced by $6.4 billion. The average business is going to save $750 per employee per year, and the average family could save up to $350 per year. So these are big savings. This is that $350, that's 2 months of groceries. That's a few months of your heating bill. Things like that. This is real tangible things, and we're saving money for families. We're saving money for people, businesses. Our government's saving a whole lot of money every year. Because one of the biggest arguments against the National Pharmacare program is the fact that people think it's so expensive. It's this absolutely daunting sort of expense, but it's cheaper. It just makes more sense. So sort of coming to conclusions about, between these sorts of things, Canadians overwhelmingly want universal pharmacare. The number was 91%. 91% of Canadians support universal pharmacare. Canadians are suffering without national drug coverage, having to skimp out on buying food, paying for heating in a cold. Ottawa's what was the coldest capital in the world last year, or the second coldest next to like Moscow. Having to skimp out on your heating so you can pay for the medicine that keeps you alive is pretty crazy in a country like Canada. And universal pharmacare is cheaper than what we're doing now. And finally, where are we on this issue? So starting in April 2018, the House of Commons Standing Committee on Health released a report recommending that Canada adopt a universal public pharmacare program. In March 2019, in the 2019 budget, the federal government allocated $35 million over 4 years to establish a Canadian Drug Agency Transition Office. This new drug agency will assess the effectiveness of new medications, negotiate the price of medications, again, that's that big thing, and recommend medications to include a national pharmacare program. The Advisory Council, so in June 2019, the Advisory Council on the Implementation of National Pharmacare, this is the report I'm mostly citing here, released its final report, and that recommended that Canada adopt a universal public pharmacare program. This program should cover essential medications for most major conditions by January 2022, and should cover a comprehensive list of medications by January of 2027. So it's a transitional thing. These sorts of things can't happen overnight, but it can happen. We can do it. We can pull this off. In November of 2019, over 175 national and provincial organizations signed a joint Pharmacare Now statement calling on the government to implement universal public pharmacare. February 2020, the House of Commons Standing Committee on Finance recommended that the government include universal public pharmacare in this year's budget, which was last year's budget, but anyways, and NDP MP Peter Julian, very, very nice guy, has also tabled a private member's bill to implement universal public pharmacare. And most recently, in March of 2020, the House of Commons unanimously supported a motion presented by NDP MP Don Davies on universal public pharmacare that called on the federal government to implement the recommendations of this advisory council on national pharmacare and immediately begin negotiations with the province to make this reality. So we're this close. We are so close to having a universal pharmacare program in Canada, which is so amazing because it can help so many people and make so many families' lives more easy. It's just we just need that final push to get it done. It needs to be announced. I imagine it'll play a big part in the next election. That's usually what I deal mostly with, is elections and that sort of thing. Not necessarily the policy stuff like this, but I'm thinking that's probably going to be a big part of our next election. Hopefully, whether it comes from the Liberal Party or the NDP or whoever, universal pharmacare. I'm personally really excited. I just want to see it happen. But that's it. There are my sources. Thank you for listening to me. And yeah, you can ask me any questions you might have about this sort of thing.